to have it. The nurse will, or your assistant will either place the jelly onto the pad. Sometimes they place it onto the back of your gloved hand. And if there was more, you would apply a generous coating to your tube. So there would be a lot more than this. Usually the entire packet would be there. Okay, so an assistant will help you with that. Okay, so now that it is prepped, you will say to the patient, sir.
Just at the tip or in the hole?
Sorry?
Just at the tip only?
Just at the tip, maybe the first inch of the tip, you will place the jelly. As it will help. It will cover the rest of it as you are inserting. So you will tell the patient, okay, sir, when I insert this, I will ask you to please swallow as I am inserting this. It will be a little uncomfortable, but it should not be too painful. So I'm not sure if we can do it on this patient because it's a doll, but he can't swallow for us. But you'll be inserting the end of the tube into the nostril, like so. And you will tell the patient to swallow, sir. Please swallow. And we will go until the point where we measured earlier. But I don't think that this patient will be able to do it. Yeah. You're not swallowing, sir. Let's see. Okay. Good job. Keep swallowing. Okay. All right. So we've inserted to the place where we measured earlier. At this point, we can get our, what do you call this? Basically it's like a large syringe. I can't remember what this is. Does anyone know what this is called? I forget what this is called. But you will insert this into the end of the tube. May I borrow someone's stethoscope? Thank you. You confirm that the end of the tube is within the stomach. So you will listen to the stomach. Essentially, listen for the sound of gas bubbles that are formed in the stomach. You will just pump it. If you are able to hear the gas bubbles, it is within the stomach. If you cannot hear these bubbles or the sound of bubbles, confirm whether or not you may have inserted it into the lungs. Okay? If that's the case, you will remove the tube, remove it partially, and then try to have the patient swallow it again. In patients that are awake, usually they will cough if you've inserted it into their trachea. They will let you know it's in the wrong place. But if they're unconscious, you will need to confirm whether or not it is in the stomach. Okay. So after that, we will secure the end of the tube to the patient's nose. And then, we don't have a bag for it. Make sure that this is above the area there. Usually there's a bag that will be covering the end of this tube, but it's not prepared here, unfortunately. So how do we secure the patient, the tube to the nose? Essentially, you will have a piece of tape, like so, that you will tear a little bit into a shape, into this form. You can see here. You will place the end of it onto the patient's nose and wrap the end of the tape. Doesn't stick. Wrap the end of it around the tube to securely fasten the tube to the patient's nose there. Okay? And then that is secure. If you want to be more secure, you can apply another tape if you want over that, but it's not always necessary. Usually just that is enough, especially if it's sticky. Okay? So So thank you very much, sir. This will be put into a bag to allow for the expulsion of the contents of the stomach if that is necessary, or this will be attached to a feeding drip. Say, for example, they're being fed through this tube. So for now, we'll just place it here, okay, since there's no material for it there. So thank you very much, sir. That concludes the procedure, and then we clean our materials up. Does anyone have any